Welcome to Tilly's Trans Tuesdays. This week we're talking about a horrible, terrible, no good, very bad concept that plagues the trans community, and you might be surprised to learn where it comes from. Transmedicalism. Hi, I'm Tilly Bridges, your host, and I'm joined by my writing partner, my best friend, my wife, our token cis representation, a lady who knows that only Sith deal in absolutes, Susan Bridges.
Hello. But I understand where they're coming from sometimes.
Oh, you just coming out as Sith on this joke?
No, I would never.
No.
They're terrible.
Okay.
But I get the murderous rage impulse. I get it.
Okay, so they're terrible, but you get it. You identify with the terribleness.
No.
Yeah, that's what you're saying.
Look, I just have evolved beyond that.
Sure.
Uh-huh.
Okay. Our returning guest is Alex Iantaffi, an award-winning author, family therapist, WPATH certified gender specialist, certified sex therapist, somatic experiencing practitioner, and clinical supervisor. Alex is currently president of the Minnesota Association for Marriage and Family Therapy and past chair of the Trans and Queer Interest Network for the American Association for Marriage and Family Therapy. They have researched, presented, and published extensively on gender, disability, sexuality, relationships, and HIV. They are a trans-masculine, non-binary, bi, queer, neurodivergent, disabled Italian immigrant who has been living on Dakota and Anishinaabe territories, currently known as Minnesota, since 2008. They are the author of Gender Trauma, Healing Cultural, Social, and Historical Gender Trauma, which was awarded the Nautilus Award Gold category in 2022 and the AA Sect Book Award for Sexuality Professionals in 2023. They are the co-author of the books How to Understand Your Gender, A Practical Guide for Exploring Who You Are, Life Isn't Binary, Hell Yeah Self-Care, A Trauma-Informed Workbook, How to Understand Your Sexuality, A Practical Guide for Exploring Who You Are, and the upcoming How to Understand Your Relationships with Meg John Barker. They also host the Gender Stories podcast. Welcome back, Alex.
It's so good to be back. Thank you for having me back, Tilly and Susan. So good to be here again.
Of course. Okay, so I wanted to talk a little bit more about the Gender Stories podcast, which we mentioned in the last episode, because that's how we met. You had me on last year to talk about my book, Begin Transmission, The Trans Allegories of the Matrix, and it was one of the best conversations I had when promoting my book. So I wanted to ask if you wanted to tell folks a little bit about what the show is and what your goals are with it. So hopefully they will go check it out.
Absolutely. I would love for people to check Gender Stories out. My first episode, just like a little word of warning, I was doing this podcast movement challenge of launching a podcast in 30 days, which was both wonderful and a lot of stress.
Sure.
But so the first episode, I was going down with a cold. I was not very good at it, but I left it out up there also to show that we can get better when we put a podcast out.
Absolutely.
Because for me, my podcast is really a labor of love. It started back in very early 2018. I knew that, I listened to podcasts. I love them. And I had some ideas. I was like, I would like to do a podcast. I feel like there are no trans podcasts out there. And actually, Tack Woodstock and I have talked about that because Gender Reveal and Gender Stories kind of started around the same time. And we were both like, where are the trans podcasters, right?
Yeah.
And we have kind of different remits in our podcast, but it was very fun to talk about how in that moment, it seemed to be the zeitgeist, the spirit of the time where, more trans people were coming into podcast world. And so, the Gender Stories podcast was born both out of the desire to have more trans podcasters out there. But the other piece is that I love talking about gender. I have a whole doctoral degree in gender studies. And I'm forever fascinated how this concept is so pervasive in all aspects of our lives, right?
Yeah.
And one of the premise of much of my work, not just for my podcast, is that is true for everybody, trans folks and cis folks alike. And of course, for us trans folks is impactful in a very different way. And also all the other intersections of identities and experiences that we have. And so really my idea was that we all have a relationship with gender, whether we like it or not. And I wanted to more intentionally and consciously explore that through both solo episodes and interview episodes. And it's mostly interview episodes nowadays, which I love because I get to talk to a lot of folks who are like voice teachers and singers and authors or podcasters themselves. But the whole idea is to just really explore life through this lens of gender. Honestly, that's the big overarching lens. And it has, the byproduct has been meeting so many amazing people, and especially trans, non-binary, gender expansive folks like yourself, Tilly, and other authors and singer-songwriters. And it's just been really wonderful to make trans community connections basically through the podcast as well.
Yeah, that's one of my favorite things about this show, because we always have a different, trans guest on, and I love just learning about their different experiences and what they go through, and all the different beautiful ways there are to be trans. It's a really fascinating thing to me too.
Exactly. And I also I've had cis guests on the show too. And I really love the conversations around thinking through the lens of gender, right? I even had people who had never really thought about it through a more critical lens, and just see those conversations just happening in real time. It's pretty fun too for me, and I think for the listeners too, hopefully.
Yeah, I think so. I love your show, so everyone should go listen. It's really good.
Thank you.
I love your show. Listen to Alex all the time, and you're so charming and wonderful. So,
you cannot see me blush, but I'm totally blushing.
Okay, for you, what has been the most surprising part about your transition?
Yes, there have been a few surprising parts. I think one of the surprising parts is just how my sense of gender, my gender expression do shift and change over time. I often say we don't express our gender in the same way as when we were 5 years old than when we're 40 or 50 years old. And I think that's true for trans and cis folks alike.
Absolutely.
But I think there is this expectation that gender is static. And it's really, actually, I feel my gender is expanding more with my transition in some ways. Before, I remember feeling like saying things like, I feel like I'm in drag all the time in my 20s as an assigned female at birth person who was presenting feminine. Makes a lot of sense now. I was still trying to figure out what was happening, right?
Yeah.
And so one surprising thing has been just how much more expansive my gender feels. And I think some people think that we're putting ourselves in a smaller box when we transition, and that's definitely not been true for me. I think the box has become bigger. Less positive, I think, surprise has been just the infantilization of transmasculine folks. And so as somebody who has done a lot of research, academic work, who's had a lot of work experiences, just seeing some of that erasure of diminishing of like my expertise and who I am, which has been very hard won as a first generation college kind of person as well, has been not great, and at the same time, like this assumption at the beginning that I would have a lot of expertise about being trans straight away. And I was like, I've just come out. I was like, I know, thankfully, I do have a doctoral degree in gender studies, but it doesn't make you automatically an expert, right? I'm still learning. And so it was like this weird juxtaposition in academic world where all of a sudden I was expected to know about my identity while at the same time having some of my expertise like really being taken away from that because of that infantilization. But the last big surprise, I think, that I didn't expect in some ways is just how trans community holds each other. I love my trans communities, and maybe I'm just really fortunate to live where I live. And in Minnesota, I think we have amazing trans community. We are a trans refuge state now. We have trans representation at the state level. with Leafinke, and shout out to her. She's just wonderful, one of our representative at the state levels. But for me, it's just like that T for T love in every way, whether it's like romantic relationships, friendships, collegial relationship, community, just the way we lift each other up and the way we hold each other in our grief and in our joy is just been a wonderful surprise to come into as a trans person.
Yeah, I would say it was definitely like that for me too, because like, there are other trans people, other trans people, but you don't understand what the connection you're going to have with them is until you come out and you're living, as trans, and you're like, oh, it's an amazing thing, the way that you can connect to people the only other people who really get what it is that, you have to deal with. So, okay, so if you had any advice for people who are just starting their transition, what would it be?
So much. It really depends where people are at. But I think one piece of advice is just to be patient and have self-compassion. I think it can be a really challenging journey for all the reasons we talked about in the previous episode, in terms of people's perceptions and people's fear, people's, ignorance, or sometimes straight up hate, to be completely honest, right?
Yeah.
It's not always ignorance. Sometimes people know better and don't want to do better. It's rare, but it happens. And so I think in terms of advice, it's just like be patient and have self-compassion. It's okay if you have a moment where you don't want to correct people's pronouns, where you don't want to advocate for yourself because it's too much, right?
Yeah.
It's okay if one day you feel super confident about who you are and another day you don't, right? There are still days where I'm like, oh, did I do the right thing by transitioning? Because the world is heavy, right? The world tells us that we're not accept. And as I'm aging, I'm like, oh, like I have those moments of like, do I still feel good in my body? And then I'm like, okay, what happened in the outside world to make me feel this way, right? And there's usually something that's like triggering some trauma or some gender dysphoria, right? And so I would say it's okay to be patient. It's okay to feel confused sometimes. It's okay to go at whatever speed you need to go. And please don't do this alone. I know so many people, and I know this as a therapist who works with trans folks, that so many people find it hard to connect with community at first because they're dealing often with so much internalized transphobia as well.
Yep.
And that can be a desire to like distance or to not be like those trans people over there, whoever those trans people over there are, right? That might feel scary because we're really scared of ourselves and our feelings inside ourselves. And so I would say, really don't do this alone. There is community out there. There are people who want to support you. There are people who've been there. Look for that support and lean on that support because, sure, cis acceptance might feel great, but it's far too often conditional. And to have siblings in your community who get what you're going through is so essential and it's so vital and so important.
Very well said. I agree. Before we get into this week's topic, do you want to remind people where they can find you online afterward?
Absolutely. They can find me on my website, alexiantaffi.com, ALEXIANTAFFI.com, or they can follow me on Instagram at xtaffi, XTAFFI. Come and follow me there. Oh, and you can listen to Gender Stories wherever you listen to podcasts and find my books wherever you buy books, which is hopefully at your independent bookstore. And if you do not have an independent bookstore where you live, that's what bookshop.org is for.
Perfect. Okay. Well, Trans Day of Visibility is coming up. So transmedicalism is something I wanted to talk about as it's related to TDOV in ways you might not realize. To begin with, please see the Trans Tuesday on Trans Day of Visibility, aka Am I Trans Enough? That was episode 13 of this show. And let me just hit you with this. The reason so many trans people feel like we might not be trans enough is because of transmedicalism. This is what I mean when I say these things are related. Actually, they're not just related, they're sisters who share a bedroom. So what exactly is transmedicalism? In the most generous of terms, it's the belief that you can't be trans if you don't experience gender dysphoria. See the Trans Tuesday on that for more info, which was just last week, episode 59. But as I said then, you don't need to have dysphoria to be trans, although As we also discussed then, perhaps broadening the term to be more inclusive would change that. But as dysphoria is presently defined by the cis people in charge of our healthcare, no, you absolutely do not need to experience dysphoria in that exact way to be transgender. You do not, you do not, you do not. You're trans if you say you are. But more realistically and truthfully, you will find transmedicalists believe that you're only trans if you medically transition, and only if you basically get all of the medical transition. So, for example, they might say you're not quote unquote really trans if you don't have horrid gender dysphoria, go on hormone replacement therapy, and get basically every single gender confirmation surgery that exists. And do you see the problems with this? I don't know how you could miss them. They're visible from orbit. If someone doesn't want HRT but needs gender confirmation surgery to feel right, that's fine. If someone wants HRT but no surgeries to feel right, that's fine. If someone can't medically transition due to cost or an unaccepting or dangerous home life or for medical reasons, that doesn't make them any less trans. If someone chooses not to transition for whatever reason, that doesn't make them any less trans. Transitioning is not what makes you trans. What makes you trans is an incongruence between your gender and your body, and that's it. You don't have to transition to be trans. And if you stop and think for 2 seconds about transmedicalist beliefs, you instantly realize there is no place within it for non-binary people. You either go from cis man to trans woman or cis woman to trans man with every medical intervention possible, the end.
Upholding the binary again.
Yes. And I'm sorry, but that's not the way it effing works. You don't get to tell other people who they are, who they can be, or what they have to do with their bodies. That is exactly what cis transphobes do to trans people. So, Alex, I'm sure you have encountered transmedicalism in all the work that you do, and have you found it to be really pervasive and hard to push back against?
So pervasive, and it breaks my heart when it comes from other trans folks the most.
Yes.
And I understand it. I understand why it's happening, but it's just so heartbreaking. I think that, I remember, also young folks starting to talk about transgender. I don't want to be seen as a transgender. I was like, what even is that? And so I did some research the first time I came across the term transgender, and it's this idea that, young people are being trans because it's fashionable, which I'm like, it's such a messed up idea. And the more I dug into it, I was like, oh, this is just cisgenderism and transphobia repackaged. And so even having conversations with young people about, hey, this is really sounding a lot like transphobia, or the kind of things that cis folks have said to us for a long time. You don't have to, you don't have to worry that you're doing this just to be fashionable and you don't want to be a transgender, right? But there's so many, I think in our community sometimes we really need to be able to talk about how, sure, we have different experiences given our social locations. And that's true in a lot of different ways, right? Trans feminine folks are going to have different experiences than trans masculine folks, and in many ways. Non-binary folks are going to have different experiences than some maybe trans folks who pass more than they, because they may or may not pass, whatever that means, right? I really love that concept of nobody passes, right? But Matilda Sycamore Burstyn, I think, and so transmedicalism is so insidious sometimes, right? It can even be just like, I remember a potential client saying they didn't want to see me as a therapist because they wanted a biological female therapist. And I was like, what? Well, technically, I fit that bill, actually. I think what they're trying to ask for is that they want a feminine therapist, which is totally fine, right? But exactly. But I was like, I don't think you know what you're asking for, because technically, whatever that means, I am assigned female at birth. So it would be like I am biologically female again, whatever that means, because, we also know that gender is much more than just like the visible things. It's also our chromosomes, which very few of us know unless we've had them kind of tested and analyzed, right? And so transmedicalism is super pervasive, and it reproduces this idea that to be trans is just to want to be an approximation of cis people, and that
Right.
cis people are the baseline, and the best we can do is be like almost like a poor copy, right, of like cis
Yeah.
people. Like, well, your biological sex is really that, but I guess you can play pretend in the world with your gender. And I think that's
Yeah.
really messed up, and it really
It is.
doesn't undermine this idea that actually gender as a binary, it's a very modern concept. It's a very colonial concept, and it's not a
Yeah.
concept that's gone on forever. And even the division between sex and gender, I understand why we make it, but I've come more and more over the past few years to look at it much more critically, and to look at it as much less helpful than we used to think, because,
Sure.
I used to talk about biological sex versus gender identity, and I've really moved away from that because it only reinforces this idea that we are a binary
Yeah.
species in every way, which we're not.
No, absolutely not.
Yeah.
Yeah.
Mhm.
Well, transmedicalism, like as you said, it's this horrid gatekeeping that happens within the trans community, and that's the last thing we need when the false cis binary of society, cis politicians, cis doctors, cis friends and relatives all gatekeep our transness. We cannot be doing it to ourselves. And now we're getting to the heart of the matter and why I said you'd be surprised at where this came from. Or maybe you won't be surprised at all because the answer is cis people. Let's
What?
have a little
Shock.
history. I know. Okay. In the past, and not the too far off past, mind you, this was the only way to transition. It was the only way cis doctors would let trans people transition because they decided that was the only thing that made us actually transgender. In 1979, WPATH, the World Professional Association for Transgender Health, was formed to try and standardize care for trans patients. It's still being used today with version 8 released in 2022. It's getting better. It's still not perfect. It started off awful. This was really hard, okay, but I found a copy of the WPATH Standards of Care version 1 from 1979. I had to get really creative. It's not easy to find. It's kind of horrific. WPATH doesn't have it on their website, and I'd be a bit mad about it if WPATH had just had it on their site for informational and educational purposes. Just attach a note saying we no longer agree with the recommendations in this, which were in many ways harmful, and we're working to be better. It took so much creative digging to find it. I don't know if it's intentionally trying to be hidden, but it kind of feels like it. So anyway, let's have a look at some choice bits from the very first WPATH Standards of Care from 1979. Alex, since you're WPATH certified now with the present version, please chime in on any of these with your thoughts. I'd love to know how things have changed in your views on these.
Oh, so many feelings, and I'll
Yeah.
have to be somewhat diplomatic, but I'm
Yeah.
very bad at it. So I probably
Yeah.
won't be, and I'm fine with that. Yeah, it wasn't even WPATH, right? It was literally the Ari Benjamin Society. And I
Yep.
remember when I was like a baby therapist some time ago now, that many trans folks would still come in and talk about the Ari Benjamin standards,
Yeah.
that even though with that WPATH, like the name had changed to the World Professional Association for Transgender Health. Definitely the most recent standards are much better, right? There is
Yeah.
a recognition of non-binary folks. There is a recognition that there are many pathways, that transition is much more mix and match than we thought
Yeah.
about before, like you said at the beginning. I mean, I had top surgery before ever going on hormones because I didn't think I ever wanted to be on hormones, for example. And that was still a little challenging under
Sure.
standards. I think I was under standard of version of care version 7 when I had my top surgery. So now under version 8 is much better. And historically, we have just treated trans people horrendously in our field.
Yeah.
I have worked with folks who are like, oh yeah, I remember. I mean, and they were talking about the 80s, so not like a
Yeah.
lifetime ago. They were talking like when I was a teenager, right? Oh yes, at the clinic, because I used to work at a university-based gender identity clinic that will remain nameless, but not hard to figure out where it was based on my CV. So I worked with some of the folks who have been involved with this for a long time, and the cis folks would just talk almost jokingly about how bad things were. Like we would have a panel if people wanted to go on hormones or go through body modification that decided where this person was masculine enough or feminine enough to get
Yeah.
access to hormones. And that panel wouldn't just be therapists and medical doctors. It would be literally like members of the public. And our front office staff used to like teach trans feminine folks how to do makeup. And they would talk about those things like, oh, in this very casual throwaway way, which was very impactful on me as a trans person, which I don't think ever really clicked for them.
Yeah.
How different that would land, right? And so that's where WPATH started, right? A lot of cis people that wanted to alleviate, in air quotes, and caretake for trans folks. And I think it's very different now. There are so many more trans providers, trans members. One of the first time I went to a WPATH conference, I was like, get me out of here. What hell is this, right?
No.
But then I was like, okay, if I'm staying in the field, but I also met some amazing people like who were really committed to changing things, like Jamison Green, I met through WPATH, right? And other trans folks I really respect a lot.
Yeah.
And I think I'm really grateful to the trans folks who engage with WPATH before I even started to engage with WPATH, because in a way, when I send the letter in to insurance for one of my clients, I know it's going to have more weight, because of that WPATH certification. And also being able to be a certification mentor means that if there are trans providers who want to work with a trans mentor, that they have access to that. And so for me, it became a matter of, okay, if this organization is really going to tell globally how to take care of trans folks, nothing about us without us, as disability activists teach us, I want to make sure that there is trans representation in WPATH. And in a way, Standards of Care version 8 is so much better because there was so much trans input. Not quite there yet. We're not the majority. We're still definitely a minority. And the higher up you go, the narrower
the less there are.
it gets, right, in some ways. And there's been trans leadership, and also it's hard because, like we said, there are transmedicalist trans folks in our field, right? And so I think we have just a long history of pathologization to get out of under. Even the idea that there should be different standards of care to deal with us as if we are apart from cis people. I mean, sure, that there can be standards of care for hormones, for interventions, but they're for people, right? When the standards of care for cis people, like there are standards of care to treat diabetes. Yay. There should be standards of care for hormonal treatment, standards of care for genital surgery, standards of care for chest surgery, right? Chest modification surgery. The standards of care are for trans folks, which in a way sets us apart and reinforces this idea of transmedicalism. I don't know, am I making sense? Or
Absolutely you are. That's very insightful.
Yeah.
Right, because trans people are not the only ones who have gender confirming surgery.
We did a whole episode about that.
Absolutely. And gender affirming care is not just for trans folks. Everybody.
That's right.
So much. Yes, we're all on the same page.
Okay. Okay, here we go. We're going to talk about some of this WPATH version 1 that was made by cis people here. Okay, buckle up. 4.1.1 Hormonal and surgical sex reassignment is extensive in its effects, is invasive to the integrity of the human body, has effects and consequences which are not or are not readily reversible, and may be requested by persons experiencing short-term delusions or beliefs which may later be changed and reversed. That is basically saying to me, what trans people want is a horrible mutilation, and they may just be lying or not even really mean it when they say they're trans. When you're starting from that mindset, things are not going to go great.
And you hear that from transphobes all the time.
All the time.
That's like one of their favorite talking points.
Okay. 4.1.4 Hormonal and or surgical sex reassignment on demand, i.e. justified simply because the patient has requested such procedures, is contraindicated. It is herein declared to be professionally improper to conduct, offer, administer, or perform hormonal sex reassignment and or surgical sex reassignment without careful evaluation of the patient's reasons for requesting such services and evaluation of the beliefs and attitudes upon which such reasons are based. You can't believe a trans person. No, no, no. They can only get care if a cis person deems they need it. Holy moly. To wit, see the Trans Tuesday on trans kids in the intake exam to learn how I had to prove I was trans to a cis woman to get the care I needed. You can find that at tillystranstuesdays.com.
So, like, it's still kind of the same in a lot of places.
It sure
You
is.
have to prove your transness, go through an evaluation.
And in a lot of places, you can't get hormones or surgeries unless you get letters from these cis doctors saying, yes, you can have it.
Yeah.
It's terrible.
Absolutely. And I'm one of those folks who does letters.
Yeah.
And now, as a licensed provider, and it breaks my heart every time. And one of the things I always say is like, I wish I didn't have to do this letter, but given that I need to do this letter, I'm going to try to make this process, I'm going to dot all the I's and cross all the T's and, do what I need to do in integrity with my license and try to make this the least painful I can for you, because this shouldn't even be a thing. I shouldn't have to assess as a mental health provider if somebody, and I always say, I'm not assessing if you're trans. I'm just assessing if you meet the criteria that we have for gender dysphoria right now, and whether you can provide your own informed consent. But we don't ask most cis folks to go through all of this, and I have the permission to talk about this by my daughter, who's a young adult now, but she is cis and she had some kind of hormonal issues when she was like a preteen, really, in middle school. And she was able to access hormonal care without any psychological evaluation, with just one visit to the pediatric OBGYN, right? And, comparing that to what kids go through to get puberty suppression, for example, at the same age, it was really so glaring to me, right? And that's why she gives me permission to talk about it, because it's so, this idea of, we're giving kids hormones. I'm like, we're giving kids hormones all the time. We just don't have a problem when it's cis kids. We have a problem when it's trans kids. Right. Because, reproductive care is hormonal care. And often people take it to deal with like hormonal dysfunction, acne, or parents' fears that their children will be sexually active without their knowledge, right? All of those things are seen as legitimate for cis kids, but not for like trans young people. And I say kids intentionally too, because there's even providers are scared to say, they're like, well, we don't treat children, we treat adolescents. And I was like, well, adolescents are children, and we shouldn't be afraid of saying that we treat children. It's like, there is nothing wrong with being trans, with getting treatment if you need access to hormones or body modification. And I think it just reinforces this idea. It just reinforces those narratives that are really ignorant and really scare tactics, I would say, that people are using to make people afraid of gender affirming care. We ask for a level of proof from trans people that we don't ask from cis people. And the last thing I'll say is, I remember I was giving this training to a large medical body, and one of the providers said, and I was explaining about the informed consent model, where you don't need any letters. And this provider looked at me horrified, this endocrinologist, and said, so if I'm understanding correctly, you are telling me that I should just believe somebody if they tell me they're trans without any proof. And this literally was like very distressed by this idea. And I said, yes, this is exactly what I'm telling you. And he was like, well, what if they're lying? And I said, I don't know. What do you do with your cisgender clients, if patients, if you think that they're lying to you? And he seemed confused about this. And I was like, you seem to have no problem believing that a cisgender patient in front of you is cisgender. So why do you need proof? And it was like, well, you've given me a lot to think about. And I was like, I sure hope so. But, like, even this idea that we're trustworthy and reliable narrators of our own identity is like almost like alien to a lot of medical doctors and to a lot of cis folks in general. And I think we should ask ourselves why are we seeing, and I think that media has a lot to answer for as well in terms of traditional representation of trans folks as tricksters,
Yep,
and
absolutely.
especially trans feminine folks.
Yeah.
And so even this idea that medical doctors can just believe what we say, like, why not? Like, cis people just get to exist and be. Why don't we just get to exist and be?
Yeah.
I just want to say, though, because I fear for, transphobe people who listen to things like this and they start pearl clutching about the whole thing. But it's like, the first thing is no one gets hormones until adolescence at the very minimum. So there's no sixth graders having reassignment surgery.
No.
Just stop it. And puberty blockers are used in cis children and in trans children.
For them.
They were developed for all children.
Yeah.
And they're perfectly safe and reversible.
Yes.
And hormone therapy is not an overnight change.
Slowest thing ever.
It's very slow. So if someone is an adolescent and taking hormones, or they are 16, 17, and they say, hey, this doesn't feel good, they stop and it goes back. It's no big deal.
Yeah.
And doctors have been doing this for years and years and years.
Yeah.
Just because you're on the internet raving about it doesn't make it true.
That's right.
Oh,
Okay.
absolutely. And yes, absolutely. And if people want to find out more, there's the old Gender Stories episode that I did with Dr. Kate Gepford, who is like a children's hospital and is like the director of care and education at Children's Hospital. And it's a lot of good information how puberty suppression works. Absolutely. And also, I just want people to think about children get medical interventions all the time. Why are just certain medical interventions that we're so fixated on? And children do go, through body modification, people have no problem putting their children on diets because of the pervasive fat phobia in our world. And that is going to be much more damaging. Not a medical prescribing provider, but I know even from a mental health perspective, that's going to be much more damaging longer term. But we don't question the care of cisgender children the way we question the care of transgender children. So I really appreciate, Susan, you clarifying those things. And I still want people to really think about why being so scared of young people getting access to puberty suppression, or a little bit older, now more like 14, 15, getting hormonal care, which is appropriate. If somebody has been out since they were like 5 or 6 years old, they want to go through puberty with their peers. They don't want to go through puberty at 17, 18, 19. Right. They just want to go and enjoy their life and be young adults. And I think that's legitimate. And I just want to make sure we're not too ruled by the fear that conservatives' voices want us to have around kids, if that makes sense.
Absolutely. Okay, 4.3.1. The psychiatric/psychologic recommendation for hormonal and/or surgical sex reassignment should, in part, be based upon an evaluation of how well the patient fits the diagnostic criteria for transsexualism as listed in the DSM-3. The DSM referenced is the Diagnostic and Statistical Manual of Mental Disorders. That's right. They thought we all had mental disorders. Isn't that fun? Let's look at some of those criteria. Quote, persistent wish to be rid of one's own genitals and to live as a member of the other sex. AKA, if you don't want different genitals, you're not trans. Do you see the roots of transmedicalism? They're right in front of you. Quote, the disturbance has been continuous, not limited to periods of stress, for at least 2 years. Did you only just discover why you felt so bad your whole life? Too bad. Wait 2 more years to do anything about it. Again, see my Trans Tuesday on the intake exam and how I had to find instances from my life I could use as examples to quote-unquote prove my transness. Quote, absence of physical, intersex, or genetic abnormality. AKA, intersex people go home, we will not help you.
That's interesting.
4.3.2 requires that the psychiatrist or psychologist have knowledge, independent of the patient's verbal claim, that the dysphoria, discomfort, sense of inappropriateness, and wish to be rid of one's own genitals have existed for at least 2 years. This evidence may be obtained by interview of the patient's appointed informant, friend, or relative, or may best be obtained by the fact that the psychiatrist or psychologist has personally known the patient for an extended period of time. Again, you can't trust trans people You can only listen to cis people who can independently confirm their transness. It makes me so mad. Quote, the best indicator for hormonal and surgical sex reassignment is how successfully the patient has been in living out, full-time, vocationally and avocationally, in all social situations, the social role of the genetically other sex, and how successful the patient has been in being accepted by others as a member of that genetically other sex. How good are they at making you believe they're the gender they say they are? How well do they conform? Do they not conform to gendered stereotypes? Not trans. I'm gonna scream. You had to uphold the false cis binary in that if you were assigned male at birth but were a trans woman, to transition you had to be attracted to men. In fact, your doctor often had to think you could make an attractive woman before they'd let you. Much worse, but entirely related, is that there was a whole lot of sexual abuse happening to those trans women at the hands of their doctors, with the threat of losing access to medical care if they refused hanging over their heads. Quote, genital sex reassignment shall be preceded by a period of at least 12 months during which time the patient lives full-time in the social role of the genetically other sex. You were forced to live as your true gender for a year before you were allowed to access the healthcare you needed.
Well, maybe not your true gender. You just had to pick one.
Well, but do you understand what that entails and how difficult and impossible that was for trans people? How dangerous. Do you realize it wasn't even living as your true gender for a year? It was living as your cis doctor's idea of your true gender. If you didn't hit every damned gendered stereotype they wanted to see, you couldn't be you. My blood boils.
Yeah, oh my God, I'm with you. I think all our collective blood is boiling right now. And I'm like, oh my God, I have so many feelings about that. It used to be called the real life test. And I did start doing letters when we still had the real life test as a requirement. And I hated it.
Yeah.
So much because for all too many reasons to count and all the reasons we talked about. But even just this idea of like the real life test was accessible only to so many people, because it's like basically they wanted trans folks to like lose jobs, especially trans feminine folks. And I was like, and who could really access this care? Who could really take the risk of being themselves in their community, right? So for me, there's also that intersection with like how we're racialized, It's no surprise that many more white trans folks usually pursue body modification, because historically it's been much harder for folks of color, especially trans feminine folks of color, to access a lot of this, and so it's just the layers of oppression, the layers of racism, white supremacists, capitalism, right? And like they're just all in there, and they're codified,
and
in
religion
this, like,
too, and
religion,
background, and
absolutely,
all of this is going to play in.
And I want people to understand that this is not distant history. This is not like the Danish girl type of stuff. I mean, yes, that is history too, but this is like within our lifetime history. Like, in the UK, I still think that if you're legally married, you need to get your spouse to sign off before you can go on hormones, for example. In Sweden, until it's only been a handful of years that they removed the and this is Sweden, a lot of people think is super liberal. If you had to get divorced and sterilized before you were allowed to medically transition.
Oh my God.
And this is like, absolutely, this is like the dirty secrets, I call them, of Scandinavian countries, because, we always look at some countries like, this is a beacon of liberalism. I was like, not for trans people, that to fight real hard, right? I think Japan has just had their first case of somebody being able to transition without being sterilized. And so
I saw that too. It's very, very recent for Japan to not force the medical issue.
And in Sweden, we're talking the last 10 years also, right? I just want to be real clear about that, right? It's like so many countries have requirements for married people to get divorced before transitioning, and for trans folks to get sterilized. Now, if that's not eugenics, and if that's not a world telling us that they don't want trans people to reproduce, I don't know what that is, right? It's like, and I say that as somebody who is a transgender parent, it's like, why do I need to have my right to reproduce taken away from me because of who I am? And I know a ton of trans parents, right? And it's like,
I am one as well.
Exactly. And why should
Yeah.
also, and like the impossibility of queerness, right? As an HIV researcher, I've literally done presentations where I've had people go, well, but if a trans man dates like gay men, are they really trans, or is there something else going on with them psychologically? I was like, are we not free to have any sexuality we want? I mean, the whole concept of autogynephilia, which literally
Oh, no.
pathologizes trans
Yeah.
women being attracted to women, almost like,
Yep.
what about bisexual, pansexual, lesbian, trans women? Like, it's basically like you can't be a full human. That's what the
Yeah.
medical system has told us again and again. If you're trans, you can't be a full human. And not only you have to prove it to us with your pain and distress, but you also have to put yourself in danger through this real life test.
Yep.
And on top of that, you don't have a right to be queer and you don't have the right to reproduce, right?
Yep.
And of course, that's changing, but that's like, that is all linked to transmedicalism as well. So,
Right.
yeah.
Yeah. That's where it all came from. And for you cis folks listening, think about how impossible and horrible it would be for you to live as your doctor's idea of your gender for a year.
I would fail.
Live exactly as someone else dictates you should based on your gender, and if you don't conform to their personal biases, goodbye any chance of being yourself ever again. And oh God, this makes me so mad. Often the only way forward was to leave your entire life behind, move somewhere new, and go stealth. A stealth trans person, again, is someone who's not out as trans, who passes for a cis person of their gender and lets everyone think they're cis. This was known as woodworking, meaning you disappear into the woodwork and aren't seen as trans by anyone ever. You were forced to hide your transness. See the Trans Tuesday on Misgendering and Passing for more on what passing as cis really means, episode 34 of this podcast. One trans woman's account of doing that very thing and how it was expected as the natural outcome, as was compulsory cisgender passing and compulsory heterosexuality, when she transitioned in the 1980s, is linked in the show notes. I highly encourage you to read it. As you'll see from her words, and as I've said a million times, trans visibility is so important. To see trans joy, to see other trans people out there living their lives, being happy and free, makes us think we can do it too. And we were forced to hide it, all of it. It was basically that or no transition at all. Trans people have always existed, despite this and everything else stacked against us. We were not a fad, we're not new, we're not a phase. See the Trans Tuesday on trans people in history for more at TillysTransTuesdays.com. But this is part of why it can be so hard to spot trans people in history. They didn't have the terminology, they didn't have the ability or the safety to be out, and when they did, so many were forced to hide it from the world. And this is where transmedicalism stems from. It was created by those cis doctors as a method of controlling trans people, forcing us into small little boxes that upheld the false cis binary matrix of society, because open and out trans people prove that binary is a lie. Trans people who don't need every single bit of medical transition prove it's a lie. Non-binary people prove it's a lie. Us being out and open helps more of us come out and be free and prove the cis binary is not real. So for many trans people who had to go through that just to be able to transition, they've internalized transmedicalism. And yeah, that's also internalized transphobia 100%. See episode 18 of this show. Many trans people forced through that bought into it entirely and told other trans people that was the only way to be trans. And it spread from there on down the line to where it's now a serious problem in the trans community. It's caused a split, where transmedicalists call those of us who know gender is more than a false binary too cute, as a way of minimizing the importance of our beliefs, like we're just some naive children who don't understand. And then the too cutes collectively call the transmeds true scum. But if it's caused this kind of division where we're making up nicknames to otherize those with opposing views, who do you think benefits from that?
Cis people.
Spoiler. Yes, thank you.
Actually, not even cis people, like the cis ideology. Like,
yeah,
yeah,
exactly right. Transmedicalists think passing is the goal, and if you don't want to pass, you're either not trans or shouldn't even bother. They think your gender expression has to conform to the rigid stereotypes of men and women, otherwise you're not quote-unquote really a man or a woman. And also, let me just say that transmedicalist beliefs are so obviously bullshit, because when you boil them down, you're left with women have vaginas and men have penises. It's reducing genders down to nothing more than their genitals. And what on actual green earth has feminism been fighting against since its inception? Women and men are more than what is or isn't between their legs.
This is why TERFs are not feminists.
No.
They like to call
Absolutely.
themselves feminists.
They have a lot of internalized misogyny.
Yeah, they're just reinforcing gender essentialism in a lot of ways. Absolutely.
Yeah. It's so blatantly obvious this is all just another method of control, of upholding the false binary so that those in power can maintain their power and not have it challenged by the proof that it's all made up nonsense and cis men really aren't better at everything and more important. It's reductive, it's harmful, it's not even true. There is more than quote-unquote man and quote-unquote woman. Gender is a spectrum, with cis men at one end and cis women at the other, and the space between is filled with 1 million color variations. As it was so difficult for me to find the horrific WPATH Standards of Care version 1, I've linked to it in the show notes, but I've also copied the entire text of it and included it in the Google Doc version of this topic at tilliestrans-tuesdays.com. We have to preserve these things so we know our history because it informs our present. We cannot forget what cis doctors put us through or what it did to us as a community. We have got to stop gatekeeping each other. We have got to stop spreading society's transphobia and doing the work of our own oppression. We have got to help each other be whoever we truly are and not what cis people or other trans people want us to be. Thank you for being here, Alex. This was such a great discussion.
Oh my God, you are so welcome. Thank you for having me. I'm so passionate about this topic. I mean, so passionate that I wrote a whole book about how intergenerational trauma works, right, within gender for everybody. Thank you for what you do, Tillie and Susan. I think this podcast is so educational and so wonderful, and I'm just so grateful to be here with you for those 2 episodes. Thank you.
Well, thank you so much. And to everyone listening, please remember, you are trans if you are out or not. You are trans if you transition or not. You're trans if you get all the medical transition, some or none. You're trans if you say you are, and you are enough. Tillie Bridges, end transmission. Tillie's Trans Tuesdays is hosted by Tillie Bridges and Susan Bridges with audio editing and sound mixing by Jillian Morgan. The Google Doc and social media versions of this week's topic and all past topics are available at tilliestrans-tuesdays.com. Special thanks to Daisy and Jane for the use of Sorry Not Sorry as our show's theme music. Please stop by and show your support at daisyandjane.bandcamp.com and soundcloud.com/daisyandjane. You can find me at Tillie Bridges on Blue Sky, Twitter, and Hive, on Mastodon at Tillie Bridges at mastodon.social, at facebook.com/TillieSBridges, and on Insta and Threads at Heck Yeah Tillie Bridges. And you can find Susan on most of those at Susan L. Bridges. You can find Jillian at Audio Jillian on Blue Sky. You can join the Tillieverse Discord server by following the link at the very bottom of tilliestrans-tuesdays.com. We hold regular watch parties for the Matrix films and other trans movies where I do a live Q&A, and it's blossomed into a wonderfully supportive, compassionate, kind community of friends. We'd love to have you join us. For more information, visit pendantaudio.com. Thanks for listening.